Welcome to Bite Size Dental Marketing. Ian,
It's another day,
it's
baby.
always a
It's
pleasure.
another day.
The co host, it's another day. Today, you wanted to talk about things that practices can do internally to support marketing,
Yes, sir.
either through the market slows down, they're in a, or they want to grow without spending more marketing dollars. I like this question because you know, it's easy to say everything is marketing, and it's easy to say that marketing is something that I can pay someone to just go do on my behalf. But today we wanted to talk about what a practice can do in their four walls with their team to support marketing, and I think it's a great exercise under any circumstance or
Mm,
reason.
mm.
Um, but with that, kick us off. What do you see as the first thing they need to be focused on?
Yes, sir. So, as you touched on, before I get into it, this is something very dear to my heart because I see this over and over again. Um, Dental practices that are very quick to look at external factors, but are rarely looking at internal factors. And this is not to say that
Mhm, mhm.
a dentist can't say these external factors are impacting me. Why are they impacting me? What's going on? Of course, you should ask those questions. Today's conversation is just for you as a dentist to think about this from another angle on what can I do to help this process and how to improve this and what is my team doing to make sure that this business succeeds.
Right.
So please keep that in mind as we embark on this conversation today. So the first thing I wanted to chat about, and Eric, I'm actually going to jump to you because I know you've seen this time and again. You have many, many years of experience in this space, and that is the question about staff. What, in your opinion, and what you've seen, the
Mm.
importance of having the right staff and how that can impact your ability to run a successful practice?
Yeah, we're taking the hard one
Yeah,
first. All
yeah.
right. I believe that most practices that struggle with marketing have something that I think of as maybe the right person in the wrong seat or the wrong person in the wrong seat. And what I mean by that is just because someone is incredibly efficient at scheduling doesn't make them a great person to answer the phone.
Mm,
Just because they're great at building your dream schedule, just because they're great at filing the claims, just because they're great at presenting treatment, doesn't make them great at the sales job that is the front
mm,
desk. And I think that that front desk role is the one that is most often overlooked. It is the one that it's a pain in the butt. No one really likes to do it. We put kind of the newest person on it. Um,
It's definitely, I would
I
say
think
it's low.
culturally, in a
It's
lot of
low on the list of this is a priority to me. It's usually the
uh
who's
huh,
my
uh
next
huh,
associate, and because I want to grow, who's my next associate? Who's my treatment coordinator? Who is my hygienist? These are the names that are often mentioned as these are the VIPs in the
hmm
business.
hmm
And
yeah,
how often do we find out that the front desk should be very high on that list, in fact, when it comes to these things?
it should be higher than it
Mm-hmm.
is. It should, and that's where I'm saying I think it's important to take a hard look at who's in the roles and what they perform. If you want to improve marketing, who is presenting my treatment, who is asking for money, who is doing my schedule, who is answering the phones. Because, uh, you know, one of the things that I think is a sub discussion in marketing is the cancellations that are running rampant today in the
Mm,
industry. Cancellations don't happen when I call to cancel. They happen in the value of the appointment when the appointment's made. If the appointment's made in a manner that I don't find valuable, I am more likely to cancel it. Now, by the time I call and say, "Hey, Sophia's sick, I can't come in," maybe it's a lie, maybe it's not. That's done. You can't call me on my lie. You can't get me to come in. I mean, there's some cultural acceptance of,
yeah, you can't say
whether
no.
I'm lying or not. You have
You
to
will
accept
come
it.
in. You can't do that. You can't do that. Yeah.
Yeah, yeah. No. So really, that's kind of a fool's game to chase it on the back end. And that's where I say, as you're focused on
Mm,
marketing, cancellations are a big part of that. And I think having the right person answering the phones that cares about the patients, that is genuine in his or her care of their problems, that understands it's a sales role of selling the practice to them, and then can get them on the schedule. And I think it can be a different person perhaps, but that to me is the most often disregarded or overlooked part, because we just try to add it onto someone's job. It's my belief that in a practice that wants to grow, phone answering, the empathy around it, if that is not in place, all other marketing efforts will be greatly
Mm-hmm.
reduced, because that's the point of decision. That's the point when all the factors come to bear. So it's great asking, asking for referrals. That's another one, that I want to talk about. Do you have other family members that aren't here? I think that's important. If you're not answering your phones great, yes, you can ask for referrals, but you're not going to be as effective at closing them.
Because you're sitting
Um,
with the same
and
issue.
that's where I
Yeah, you
think,
did.
it begins at the,
Yeah.
yeah, it begins with not just how technically effective you're answering the phones. I want empathy. I want grace. I want understanding. I want patience.
Knowledge,
I want
knowledge
to
of the
get
treatments.
behind what they need.
I think that's a big one.
Yeah, yeah,
And that segues
yeah.
perfectly, Eric, what you're saying now from so I'll recap. The first one was the staff and how important the staff is to help your marketing efforts and also the success of your business. And that ties into the front
Mm,
desk, and this segues into our next pillar that we want to talk about, and that is calls and how calls are treated, as you just
mm,
mentioned. What people often forget is that there is one point of entry to this practice in most cases. I understand you have walk ins, I understand there's some rare
mm.
unicorns out there, but the point of contact in most of your marketing efforts is going to be a phone call. And you as a dentist, and as I mentioned, this ties into the second point. You as a dentist need to you need to understand what is going on those calls. You need to understand how those calls are being fielded. You need to understand the type of questions that people are asking. And if you don't have time for this, you need a marketing agency that's going to be able to help you with these things, or you need somebody that you employ that's going to help you with these things. And they need to know what's going on the phones, because it's the perfect case study of what your patients are asking or what potential patients are asking. And that can then be a very, very valuable tool, which ties back into your overall marketing. And that's how that portion of internal marketing can help you. I mean, you can't convert if you don't have a good person operating the phones. You can't. It's as simple as that.
And there's a lot of great coaches out there that do phones. Melinda Hayford is great. And there's All Star. There's some others that, and finding one that fits your philosophy, finding one that you resonate with, I think is
Mm,
important. I think there's 1,000 ways to answer the phone amazing. Now, I'm going to argue, I think it comes down to empathy. I think it comes down to, being able to articulate the practice well, and the tactics around how to answer, do you take my insurance? But there's 100,000, there's so many ways to answer the phone amazing, but it takes more time and effort than we realize to do it
mm,
well. And that's the part that I really wish. And whether it's Melinda, whether it's All Star, whether it's someone else, I do encourage practices to get training for the front desk. The dentist has had training, the hygienist had training, the assistants have had training. Get the front desk the support they need to be effective.
mm. And that, I mean, I love that all of these things, we did not plan this. They're tying in by chance for the listeners. But the next one is patient experience. So we went from the type of
We plan it a little bit.
just a bit, but not as much. I love that we have the first thing is the staff, the people in this building. That's important to you. The second one is the phones, how it's being answered, and how that's relating back to your
Mhm,
marketing efforts.
mhm.
And that ties into the third point that we want to talk about, which again is something so important, is the patient experience. How much attention are you actually giving to the patient experience? Have you gone anytime recently and actually put yourself in a patient's shoes, Mr. Dentist? Have you done that? Have you gone around and said, okay, if I walk into this practice, what is my experience? How is this going to play out if I am a new patient? From picking up the phone to walking in the first time, to the type of brochure that I'm getting, to how I'm doing my new patient papers, to how I'm being coordinated throughout the building, to when I walk out after my treatment. Again, something that is so, so, so important, but it's so easy to fall into the motions of things. Just keep them coming.
Mhm,
Just keep
mhm.
them coming. It's fine. Another new patient. So that's another thing that I really, really encourage dentists to do, is to put yourself in the patient's shoes and see what you can do to make it amazing. Not just for the patient, but also again to play back into marketing efforts and how we put it out there.
Now, do you talk to Ian Senior about that? Would you do you tell him to go into his practice and see it through the patient eyes?
I have, and having a father as a dentist has also given me insight into the difficulties of trying to get dentists to do these things.
Mhm.
I say that respectfully, but it's the truth. It's the truth. I love you, Dad. But it is a tough thing, and again, something I love to say, and again, I say this with so much respect to all dentists, is dentists go to school to become a dentist, and you and I have spoken about this at length, and they come out,
Mhm.
of dental school, and they're all of a sudden expected to run a business and do it successfully and do 10,000 other things that there was no preparation for.
Mhm.
And that's where it becomes very valuable to listen to outside perspectives on, these are the things I should be optimizing, these are the things I should be thinking about, while also being a good dentist. So I know dentists are very focused, but think about these things, because it will make your practice run better. I promise it will.
I would say at a minimum, uh, ask one of your patients that you believe has a high degree of candor what they thought of the when they walked in. What would you improve anything about the practice? And I think the overall theme in all of these is be curious, be interested in the patients, be interested in the staff. But I, I believe you're right that seeing the practice through the eyes of the patient would inevitably improve the patient experience. um, Little things, as they walk in the waiting room, does it look clean and inviting? And it doesn't matter about the clinic. That has nothing to do with clinical care. But I definitely, when I walk into an office, I am judging the room as I'm walking
100%.
through it. I am looking
Every
at
time.
little patches of carpet. I'm looking at you know chipped paint, things like that in through it. I'm looking at a tile fell off, and I'm looking at stains. Of course I am, and because as I walk through there, I associate, because I want to run a clean operation, because I want to run a clean agency. I We have a saying: if I can't trust you with the little things,
Mm.
how in the world could I trust you with the big things? And I think as you talk, that's where my mind went, was focus on the little things that patients might see, and that will improve the confidence they have. And to build on that, I think another thing that improves the confidence they have, or I don't think it, I know it, is the handoff between team members
Mm.
is another one in marketing that
I've heard that one a lot.
I wish more practices
Yeah.
focused on. And I don't want I want the hygienist to talk about oral health in a serious manner. I want, when the doctor comes in, I don't want them looking at a little spot. I don't want them, I don't want to just watch
Mm.
something. And I know that we're just going to watch something, but I want to use words around, I am worried about this. At some point, we will need to resolve it. Now may not be the right time.
Mm.
I like that because I'm showing value to things. When I'm reappointing someone, listen, you asked for to come in on Wednesday at 2 o'clock. I just, and again, I'm a little bit in sales. I want to acknowledge that. Listen, Ian, it's a really busy time. I'm going to lock it in for you, but I'm going to need you to be there because my day, that's a tough time for
It's a
me,
great point.
and I'm giving it
Yeah.
to you. And those little things, just the handoffs, the being respectful to each other, supporting each other, and even as the hygienist or the assistant walks them to the front desk, don't speak in code.
Mm.
Uh, You know,
You want no
talk to them
uncertainty.
less they're
Yeah.
there. Yeah, and between the focusing on the handoffs between team members will give the patient that more confidence, and that kind of ties into the little things. If I perceive you to be doing the little things well, I know that the big things can be handled too. But if the little things aren't well, I do have questions on the big
Hmm.
things.
And I think that plays
Mhm.
into most of the medical industry in terms of service providers. If I'm walking into a doctor's office, if I'm walking into a dentist's office, if I'm walking any type of medical profession,
Mhm, mhm.
as you're saying, if it doesn't look up to scratch, I immediately question your commitment to your craft.
Oh yeah,
Immediately.
oh yeah. Even the outside, I I'm so disappointed when we see these beautiful interior pictures of a practice and you roll into their parking lot and there's trash in the corner of the parking lot because it hasn't been swept. The bushes aren't well
Mm.
manicured. The door isn't working well. And I know it seems silly because a dentist wants to believe that the value they provide to the patients is clinical in nature. And I agree, it is. I'm not saying it's not. Emotionally, it's not, though. Emotionally, I may not be excited to refer someone because, man, it is dirty, because it's not as clean as I wanted, because there are tears in the fabric, whatever the case may be. A practice that is not getting 50 to 60% of its patient base via referrals is there is something wrong with the patient
Mm.
experience. No question.
Mm.
And that to me would be the first benchmark is if you look at your patient base and not more than 50% of them came from referrals. I unfortunately in the words of Doja Cat, I said what I said. You're not doing a good job on patient experience.
And returning, I mean,
The prophet
and
Doja Cat.
one of Eric's favorite artists, which you would not expect, by the way. Another metric there that I love, Eric, is patient retention. Plays into that as well. If you're
Mm,
having a massive group of patients, and with all these softwares today, you can track this. If you're not tracking this, that's another internal improvement that you need to be making as a dentist. If you're seeing that 30% of patients are not coming back to your practice, there's something wrong. You need to start digging. You need to start figuring out what's going on. And
yeah.
if that's the patient
Mm-hmm.
experience, you that's something you need to figure out. Um, one thing tapping onto the rest of figuring out and digging in is we've spoken a bit about optimization. Yeah, I also wanted to touch today on internal marketing efforts that your staff can actually help you with when it comes to new patients. And the one you've touched on, referral programs, and we can get more into that in a bit. But patient reactivation is another one that I've been very passionate about and that I've seen work over and over again. And when I talk about patient reactivation, I'm not talking about sending a postcard or picking up the phone and going, "Hey, we haven't seen you in a while. Do you want to come
Mm-hmm.
down?"
Mm-hmm.
Here's an ideal world for me. You have a software that you can filter by treatment, by the last time you saw them, by if they have a family there, if they have a partner that's been there. You need to find out as much as you can about that patient before you can even think to send a card or an email or anything. Because generic marketing is old
Right.
marketing. We know this by now. That's why we
Mm-hmm.
have
Mm-hmm.
such
Checking boxes.
exactly. That's why uh, even with our agency, we have such a strong push for send me organic content, send me organic feedback from patients, letters that was written, anything that is true to you is what should be marketed, and that also ties into patient reactivation. We don't want to send someone a generic post of, "Hey, we haven't seen you in a while, come back." If you see on your file that they had a missing tooth when they were here 6 months ago, I want you to be pushing dental implants to that person. If you saw that they mentioned at
Mm-hmm.
some point something about a wedding coming up next year, and there's a little note about it. And this is where having someone on yourself that pays attention to these things in order to know when someone said they're having a wedding in 8 months or 10 months or whatever, we're getting them in for teeth whitening, them and all the whole bridal group, everyone. But that's how I'm reactivating them with something that speaks to them.
Mm-hmm. No, I like that a lot. Calling me and telling me I don't have a cleaning appointment is great, but there's probably a reason, and you need to get behind that reason. And I love the idea that you had around look at what treatment I have and make it personalized. Look at what notes you may have on me. If we can't get you in, can we get Evelyn and Sophia
Mm.
in? I think as you were talking, that's where my mind went. And just be curious. Have someone who's knows the patients and can speak to them in the text message. And whether it's dental intel that you're pulling reports or Dentrix or you got a call, whatever it is, you have some mechanism to do a little homework and prioritize who you want to reactivate and make notes on what they tell you, why they didn't. So you can close them out as a patient and move on. And,
Because that helps you with the patient experience again that we spoke about a
because
second
that'll
ago.
help you
Yeah.
hone the next
Yeah.
list. Right. If I can say Ian's not a patient anymore because he moved, Ian's not a patient anymore because, he passed away or, whatever, I can now focus on my patients that didn't or aren't currently on the hygiene schedule with more purposeful
Mm.
intent.
Yeah, I like that very much. I like that. And that, I mean, again, the segues now into our last thing that we want to chat about is referrals. That's another sleeping giant that we've seen over and over again, that it can make such a
Mm-hmm, mm-hmm.
massive impact, as we've said, when things slow down externally, or you're feeling a bit slow on the schedule, and maybe there's downturn in demand online, or there's marketing is not doing what you wanted right now. Work with your team to build a type of referral program. Work with the creative team from your marketing company to build a referral program and build graphics and do something, a card. It goes a long way. And then build in a reward program to incentivize someone. That's another big one we've seen.
I have I have a very unpopular
Tell
opinion.
me.
I do not like the incentive
Tell me
programs.
why.
I like none of them. Well, uh, before I dig in, when you say a referral program,
Mm-hmm.
what does that mean to you?
To me, it means incentivizing an existing patient base to be advocates for your practice and to bring them in.
Man, you had me with everything except incentivize.
Okay.
I know that, and I am against it. I'm not. I'm not actually neutral on it. I'm against it, and I'll tell you why. It is my belief, and when I look at my behavior, when I look at other people's behavior that I'm friends with, when Emily's and yours, and other people that I have domain knowledge on their lives. I've never referred someone for $25 or $50,
Mm.
and maybe some people do, but I don't think that it's common. I refer someone because you gave me a great experience. I refer someone because I'm proud of
Mm.
the effort. I refer someone because I think it's what's best for them, the prospective patient, perhaps. And I believe in my heart that giving me a $25 gift certificate or $50 off whitening or whatever, it cheapens that engagement. It's not a monetary event, it's an emotional one. And if you show me enough value, if you show me enough care, I should want to talk about the dentistry. I should want to show off what happened. If you give me an average one, yes, I have to incent.
Mm.
But I think it cheapens the engagement. And I know that's an unpopular opinion because everyone likes to have a
Incentivize.
referral
Yeah.
program. I do want a referral program. But a referral program to me is I am going to ask every patient, how was your visit today? And I'm going to be purposeful. I'm going to have a checklist, by the way. How was your visit today? How was your experience? How did everything go? Oh my God, isn't Dr. Majors amazing? She, hits it the first time, and it's great, right?
Mm.
And they're going to say good generally. Okay, great. Do you have any? Do you have a twin? Because we'd love to see them too. And if you don't have a friend, does the rest of your family have an appointment with
Mm.
us? And you know, the most valuable thing, the best feedback you can give us is by, if someone asks you who your dentist is or if they need a dentist, we would love for you to mention us. And I'm choosing to be purposeful in, I'm saying they were a great patient, of like, do you have a twin or someone just like you? I'm sort of, pandering to them that I enjoy them as a patient. I am making sure that I have their family, and then I'm not telling them to go shout it out and all. If someone mentions dentist or you see someone looking, we would love to
You
have them
plant the seed. I like that.
and be honored if you would
Yeah.
make us. And I like that because that's my referral program.
Mm.
I'm being interested in them. I'm making sure their family's covered. And then I'm saying, I would love it if you would mention me in the event someone's mentioned dentistry. And I'm not putting a burden on them to go chase down 5 people or whatever.
Mm.
Now, I'm going to talk out of both sides of my mouth here.
What if then?
I don't like
What if the
incentives,
incentive is a Tesla?
but oh my God, no. But if I had someone that did send me 5, 6, 10 patients, I would do something very nice for them.
Okay, I see.
But it would be after the fact and at my discretion. So the next time they come in for their cleaning, and again, I'm going to go crazy, I might say, hey, it would have been $260. Don't worry about it today. I'm going to cover your cleaning.
Because they generated $5,000 in
I'm only going to do it once
or whatever for you, so it doesn't matter.
Sure, because they sent me amazing patients or whatever it is. And I'm not going to say it's for generating my new patients. I am going to walk up and say, Ian, thank you so much for being a patient today. I'm going to go ahead and cover your cleaning. And I'm not even going to get into why I'm covering it.
Okay.
I'm just going to thank them for being an amazing patient. And that to me is my referral program.
I think that was a flawless argument. I have no rebuttal to that. Honestly, you've changed my perspective on that to a large extent. Because you want to go to people, we need to give them something to give something to us. But I like what you're saying is you're planting a seed without really trying. You're just doing what you need to do best, and that's how you create the cheerleader or the advocate for your practice. It's not. Mm-hmm. And I love that you said the next time you don't say, I did this, thank you for sending me 6 patients or whatever, I did this.
No, I'm definitively not making it transactional.
Exactly. You just keep because now they're like, whoa, like I went to Dr. Hubbard today and he just like scrapped my entire cleaning. Amazing. And then that process continues. So that's a great point, Eric.
No,
I agree with you there.
Well, let's end there then, buddy. Let's end on a high note.
So that, ladies and gentlemen, was things that you can do in your practice today to improve to optimize the practice to be performing better, and ways that you can get new patients without having to draw more from external marketing dollars. Thank you for coming.
That was your Bite of Dental Marketing.